Good afternoon, and welcome to the webinar on demystifying victim costs. I'm Valerie Levshin, and I'm a policy analyst with the Cost-Benefit Analysis Unit at the Vera Institute of Justice. And I'm here with Tina Sanford, the Director of New York State Office of Victim Services, and Kathryn McCollister, Assistant Professor at the University of Miami School of Medicine. Today's webinar will examine victim costs, particularly in the context of conducting a cost-benefit analysis in criminal justice. The reason we wanted to discuss this topic with you today is that victimization plays a key role in our justice system. Our justice system, in many ways, is designed to address and prevent victimization and its consequences. So when we consider criminal justice initiatives, it's important to take victimization into account. In other words, when we're looking at programs and policies in criminal justice, when we're considering how much they'll cost, what outcomes they'll deliver, it's important to determine their impact on victimization. Now, victimization might seem like an area that's not well suited for quantitative analysis, but there are many people whose work makes these costs very concrete, and we have two great panelists today who will discuss their work with us. Before we get started, I'd like to get to know a little bit more about you. Please answer the question on your screen and let us know your level of familiarity with victim costs. Are you very familiar, somewhat familiar, or not at all familiar? The results are coming in. It looks like most people are somewhat familiar or not at all familiar. That's great, because the webinar will be fairly introductory, although we will delve into some of the details. I do have just one more question for you. Which category best describes your organization? It looks like a large proportion of the participants are from criminal justice agencies. We have a number of people from research and academia, and quite a few folks from statistical analysis centers. That's great. We'll definitely keep that in mind as we go through the presentation. We have a full agenda today. I will begin the presentation by talking about the role of victim costs in a cost-benefit analysis. Then Tina Sanford will give an overview of victim costs and share her perspectives on why measuring victim costs is important. Then Kathryn McCollister will talk about the methods for estimating victim costs. And then we'll have a discussion and a Q&A session. You may ask questions anytime during the webinar using the chat feature on the left-hand side of your screen. We'll address these questions in between sections and also during the longer Q&A period at the end. If you have any trouble with the webinar, please contact ReadyTalk at 1-800-843-9166 or email them at help@readytalk.com. This webinar is being recorded, and the recording and the PowerPoint slides will be posted on cbkb.org, which is the project website of the Cost-Benefit Knowledge Bank. So without further ado, I'll spend the next couple of minutes talking about the role of victim costs in conducting a cost-benefit analysis. First of all, what is cost-benefit analysis? It's essentially a tool for comparing the pros and cons of programs and policies. It's a great way to assess a particular program to see if it's worth the investment, and it's also a good way to compare different kinds of programs to figure out which program delivers the greatest results at least cost. It could be thought of as an approach to policymaking, in the sense that policymaking tends to be a very political process, and using cost-benefit analysis is a way to inject objective information into that process. So what's involved in doing a cost-benefit analysis? I'll quickly go over 5 key steps. The first step is to determine the impact of the initiative. What impact does it have on crime, recidivism rates, substance abuse, or any other desired outcome? The second step is to determine whose perspectives matter. In other words, whose benefits and costs are you counting? In criminal justice, a lot of times we consider 3 perspectives: the perspective of taxpayers or government budgets, the perspective of victims, and this is the perspective we're discussing today, and the perspective of participants, the people who are most directly affected by the initiative. Step 3 is to measure the costs, both the startup and the operating costs of the initiative. Step 4 is to measure the benefits, and this is where you place a dollar value on the impact that you measure in Step 1. Step 5 is to compare the costs and benefits. to see whether the benefits outweigh the costs and the initiative is worth the investment. And this is why it's really important for the impact to be in dollar terms so that you can compare directly the costs and the benefits. So you can see, looking at this process, that victimization plays a pretty important role along the different steps of doing a cost-benefit analysis. Another way to think about it is that crime imposes costs on victims. So if a program or policy affects crime, cost-benefit analysis needs to account for victim costs. So if that program increases crime, then the cost-benefit should measure the victim costs. If the program decreases crime, then the analysis should measure the victim benefits, which are essentially avoided victim costs. But all of this can be challenging, and a lot of times we're asked questions about, how can you place a dollar value on victimization? How can you place a dollar value on rape, on murder? Is it possible? Can you do that accurately? Is it ethical? Is it necessary? And these are all very legitimate and challenging questions. But fortunately, in the recent years, researchers have made great progress and have developed methods to pretty accurately measure the monetary and the non-monetary victim costs. And these costs can be used in a cost-benefit analysis to ultimately examine programs and determine which programs are most cost-effective. One of the reasons it's important to incorporate victim costs in a cost-benefit analysis is that it helps measure the full benefits of programs and policies that reduce crime and compare them to costs. So if we wouldn't be including victim benefits in the overall benefits of a program that reduces crime, we'd essentially be undercounting its benefits and potentially underinvesting in programs that have a significant impact on victimization and public safety. Another reason is that including the victim's perspective in policy analysis is that it brings victims' perspectives to the table, to the conversation on policy and budget decisions. So that was just a quick overview of doing cost-benefit analysis and what role victim costs play in that process. Now I'm going to hand it over to Tina Sanford, who is the Director of New York State Office of Victim Services. And her office provides compensation to victims, to crime victims, for their direct out-of-pocket expenses. So she'll speak to us directly from her experience about the kinds of costs that victims typically experience. Tina?
Thank you, and good afternoon, everybody. I'm very pleased to represent the New York State Office of Victim Services and to join Valerie and Kathryn in the Vera Institute of Justice's webinar that's intended to help demystify victim costs. At our office in New York State, we have a three-pronged mission. The first prong is to compensate victims for their out-of-pocket expenses. And when I think of that word compensate, it's almost full of challenges itself, because there's really no way to compensate a crime victim of a horrendous crime. But I looked in the dictionary, the American Heritage Dictionary, at the definition of compensate, and basically what it says is that it defines it as to make up for or to counterbalance by using an influence that equally counteracts another. Well, I think you'll find, certainly, if you don't already know through the course of this webinar, that you're not talking about equal counterbalancing when you're talking about compensation. It may not even be possible. So I prefer to look at it as an assistance to victims for their out-of-pocket expenses. The second prong is to fund community-based services for victims throughout our state. You would learn, if you don't already know, that every state in the United States has a compensation program or a victim assistance program. Some states, like New York, does both together. Other states have different government entities, or in some cases probably even not-for-profits, serving one or more of those purposes. The third prong is to advocate for the rights and benefits of all crime victims. And I can share information about how you find out about other state programs like ours if you're interested later on in the presentation. One might ask why you would measure victim costs in policy analysis. It's my perspective that one of the reasons why you want to measure costs and why it's important to measure costs is to educate criminal justice professionals, which would include law enforcement, judges, prosecutors, as well as lawmakers and policymakers on victimization costs. Also, to justify increased funding for crime prevention initiatives. It's my belief that prevention reduces the potential for new and repeat victimization. And also to understand the importance of restitution and compensation. If more victims are ordered restitution through the criminal justice process, that's a benefit to them. If more programs are supported financially in the ability to compensate victims for their losses, that's a benefit, obviously, to victims. There are two different kinds of victim costs. I'm going to begin by talking about the monetary, or we're using the word tangible as a synonym for monetary. Tangible monetary victim costs. There are four primary types of victim costs that agencies like mine and even the courts deal with in terms of how to look at victim costs. The first is medical expenses. This includes everything from the trip to the emergency room to follow-up care by specialists when physical injuries are involved. Another is counseling expenses, whether it's an MD, PhD, or some other kind of licensed therapist. These are significant costs to victims. Essential personal property. In New York State, we have a category of costs that are called essential personal property. Other states handle these kinds of property costs differently, but in New York State, essential personal property is defined as articles of personal property necessary and essential to the health, welfare, or safety of the victim, such as prescription eyeglasses, clothing, or even certain furniture. And finally, another of the primary is lost earnings. If a person is physically injured, whether they're out of work a day or several weeks or forever as a result of the crime, these are costs to the victim. Additional tangible costs are the following. These include transportation to court appearances, crime scene cleanup, moving expenses, occupational rehabilitation expenses, the costs of domestic violence services and shelter, and burial expenses. The second kind of cost is the non-monetary or the intangible costs. This is a broad group of costs. And these are the kinds of costs that agencies such as ours doesn't directly compensate. These include pain and suffering, fear, decreased quality of life, and psychological distress. I want to note that in some instances, tangible costs can be related to intangible costs. And by that, I want to go back for a second. When I spoke earlier about relocation expenses, for example, if you look at the intangible of fear, and the ability to help a person to relocate who may be afraid of the perpetrator returning, or to get enhanced security, that might help to reduce fear. At the very least, it helps to address the fear factor. Counseling may also be an intangible cost that's able to be, quote-unquote, compensated to a survivor to address an intangible cost. Counseling might assist with psychological distress as well as pain and suffering that's emotional. I want to tell you about two case studies and wrap my piece up by talking about them and using these examples. The first is a physical injury claim. In our state agency, we address three different kinds of claims predominantly. Physical injury is the greatest group of claims that we see. We also address death claims as well as essential personal property claims. This is an example of a physical injury claim. In our state, sexual assault victims, as defined by Article 130 in our penal law, which has to deal with most of the sex crimes, rape, sodomy, course of sexual conduct against a child, are presumed to have found the victim suffered a physical injury. So a victim of a sexual assault in New York State is presumed to have suffered a physical injury, and therefore they are eligible for the full range of services and assistance that are available through our agency. In this example, the individual was the victim of an extreme childhood sexual abuse committed by multiple parties in the family at a very young age. Over the life of this claim, this individual has received over $200,000. Most of that has gone to assist with inpatient and outpatient treatment and counseling, because somewhere along the line in this person's treatment, they were diagnosed as suffering dissociative identity disorder. The second case study is of the essential property nature. This is a personal property claim. And to be eligible for a personal property claim with our state agency, the individual has to either have suffered a physical injury, fallen into one other type of crime, specific crime type area, or be under 18, 60 or over, or disabled. This individual was the victim of a petty larceny. They were eligible by virtue of the fact that they made the claim and the crime occurred when they were over 60. The loss in this case was a box spring and mattress estimated to cost over $900, and a suitcase full of clothing estimated to cost over $800. This person had insurance, and it's significant to note that we are payer of last resort. So if a person has insurance, homeowner's policy, automobile policy, they have to apply to that first. But we have a $500 maximum for essential personal property. And so in this case, the deductible for this person's insurance policy is $1,000. We're able to, because the person is eligible for compensable losses, we're able to pay the maximum of $500, which they can then use to apply to their deductible and perhaps come closer to getting the full value of what they actually lost.
Thank you, Tina. Thank you, Tina. That was a great presentation, and I think the examples in particular make the costs very concrete. We do have just a couple of questions we wanted to address. We have one question from Ed Katz. Do courts in New York not always order restitution on lost earnings?
That's correct. New York courts do not always order restitution of any sort. Loss of earnings, I think, is probably one of the rarer categories that a court would order restitution.
We have another question from D.D. Kurth. It was said that we should do cost-benefit analysis to educate criminal justice professionals. And the question is, how do you reach these individuals? How do you encourage them to listen and read to research findings?
I think training opportunities like this is a good place to start, reaching out to them where they are. All criminal justice professionals have associations that they're part of. Some of them have associations that provide training when they begin the type of work that they're in that are mandatory. That's a great opportunity to plant the seed of information. Also in their professional association meetings, to have a seminar available, I think is a helpful place to offer this kind of training, this kind of information. I think there are a lot of different opportunities to get the word out and to get the information and to educate professionals in criminal justice. And I just think we have to take every opportunity that we can find to give them good and accurate information, because I think most professionals want to have good and accurate information upon which to base their work and their decisions.
Great. Thank you, Tina. At this point, we're going to move forward with the webinar, but we will have a longer Q&A period at the end where we'll be able to address some of the additional questions. Up next, we have Kathryn McCollister, who is an assistant professor at the University of Miami School of Medicine, and she has conducted a study measuring the monetary and the non-monetary victim costs for a broad range of crime categories. And several institutions, including ours, are using her victim cost study in the cost-benefit analysis. So we're very fortunate to have her here with us to discuss the methods she used to estimate those victim costs. Kathryn, please go ahead.
Thank you, Valerie. It's really a pleasure to be here and to follow Tina's excellent presentation. I think she laid a wonderful foundation for understanding the different pieces of victim costs. Let me just say a little bit about myself. I'm an assistant professor of health economics in the Department of Epidemiology and Public Health at the University of Miami Miller School of Medicine, and also a member of the Health Economics Research Group, which includes faculty in various departments at UM, including sociology, and we also have members from affiliated institutions. And HERG is really the place where the current study that I'm going to be discussing took place. And we conduct research on a variety of topics, primarily looking at the economics of substance abuse treatment and prevention, but we also have some studies looking at the economic impact of HIV/AIDS and criminal justice programs, mental health, and some other varied studies in there. So before I get started, let me just give a quick overview. I'm going to describe our study and talk about the methodology we use to estimate the cost of crime. I'm going to also provide some examples and give a more detailed presentation of victim costs using robbery as an example offense. And then finally, at the end, I'll present a summary table just showing all of the 13 different unit cost estimates for offenses that we came up with in this study. So the study that I'm talking about is entitled The Cost of Crime to Society, New Crime-Specific Estimates for Policy and Program Evaluation. It was a 2010 study published in Drug and Alcohol Dependence. In this study, we measured the societal cost of crime, focusing on the three main components: criminal justice system costs, which include things like police protection, legal and adjudication services, and corrections costs. We also include crime career costs, which are essentially are captured as the opportunity cost of engaging in crime as opposed to more productive legal activities. And then finally, victim costs, which is what we'll focus the talk on today, which includes two separate pieces as Tina was describing. So we have the direct losses associated with medical care, lost earnings, and of course property loss and damage. And then we have this big intangible piece, which is associated with pain and suffering and reduced quality of life and the things that Tina described so clearly. So as I mentioned, this 2010 study estimated the societal cost of crime across 13 different offenses. And these crime cost estimates are very important for the sort of research that I do, in which we are measuring the economic impact of substance abuse treatment and other programs as well. We look at drug abuse treatment and prevention. We look at crime prevention programs. But essentially, any benefit cost analysis that we do relies on estimates like this to measure the economic impact of reduced criminal activity, which tends to be the most important piece in a benefit cost analysis of certainly of substance abuse treatment and of other pieces as well, because crime is such an expensive thing. And so even modest reductions in crime can generate huge benefits to society. So let me go over in detail the costs that we included in the study. So on the tangible side, the monetary costs included medical care, lost wages, property loss and damage, cash losses. We also included mental health counseling costs. And we included this perhaps lesser known piece, which is the risk of homicide, which I'll talk a little bit about how we estimated that in just a minute. On the non-monetary side, we included specifically pain and suffering, and other important pieces are decreased quality of life and psychological distress, which are a little bit harder to get at with existing data sources, although presumably these concerns are folded into, in some degree, the pain and suffering estimates, but it's difficult to piece these out individually. So why do we want to include intangible costs? And economists will argue that particularly when you're doing a benefit cost analysis, you should try to represent the societal perspective. And the societal perspective takes into account costs incurred by any member of society. It doesn't just focus on the more narrow perspective that is the taxpayer or the criminal justice agency. We want to look at the full impact on society. And keeping that in mind, the impact of crimes, particularly more violent offenses like aggravated assault, rape, sexual assault, robbery, would be underestimated if we ignored the intangible victim losses. In fact, we found in this 2010 study that the direct costs really only account for about 12 to 47% of the total crime costs for the offenses that we considered in this paper. So more than 50% of the costs of crime are made up by these intangible losses. So I'm going to go very briefly over the methods for estimating victim costs. As you can imagine, there's a lot of detail here which it'll be impossible for me to get into today, but you can certainly refer to the paper or some of the citations that are listed at the end for more details. So there's three common approaches, or perhaps better known approaches, for estimating victim costs. The first one I'm going to discuss is cost of illness. There's also the jury compensation method, and then a third called the willingness to pay method, or this is an approach that's housed under contingent valuation. So let me talk first about cost of illness. Cost of illness is perhaps better known in more clinical literature and is used to estimate the economic burden of diseases like diabetes or HIV. And it focuses specifically on tangible costs. So these would be medical costs and lost productivity primarily. In terms of the approach, it's pretty straightforward. You essentially take the total tangible costs of, in this case, an offense, but it could also be, you could be talking about a particular disease, and you divide by either the number of afflicted people or, in this case, the number of crimes, and that gives you, a tangible cost per crime using this method. The main sources of tangible cost data that we used in our study come from the Department of Justice, which collects information on medical expenses, cash losses, and so on. We supplemented this with information from FEMA, the Federal Emergency Management Agency, which has arson-related damage data, and also the Bureau of Justice Statistics, which has a number of important reports and sources that we used, and in particular has data on the number of crimes in each category. We also included mental health care costs into this piece, which falls under sort of total medical care spending by victims. And we actually used estimates by Mark Cohen and Ted Miller, who have done a number of related studies in this area. They had a 1998 study where they actually surveyed mental health care professionals about the sort of treatment and the costs of the treatment provided to patients that reported being victims of crime. And so we were able to fold this in to get a specific counseling treatment cost per offense. And finally, we included something that's maybe not generally associated with cost of illness, but would be, as an important piece on the tangible side, the risk of homicide costs. So as you can imagine, certain crimes carry some risk that they're going to result in a homicide. Things like aggravated assault, rape, even robbery can result in a homicide even if that wasn't the original intention. And so we need to capture that risk and the costs associated with that risk in the victim costs. So the way we do that is just multiply the probability that a certain offense will lead to a homicide by the individual's average lifetime earnings. And essentially we're valuing life in terms of earnings, which is a very conservative approach, and we're expressing lifetime earnings as present value, which is that's a bit of jargon, but basically the idea is that since we're looking over the life course, we need to translate future income into present dollars, taking things like rate of return or interest into account. So the way you do this is you simply apply a discount rate to this stream of lifetime earnings, usually something like 3 to 5%. And you're able to express that in terms of a net present value. So moving on to the second approach or method for estimating victim costs is the jury compensation method, which it was actually developed by Mark Cohen. I mentioned him before, and let me just say again, he's done a lot of really seminal work in this area. So with the jury compensation approach, this is a way to measure the intangible piece, the pain and suffering that victims incur associated with crime. And essentially, we rely on jury award data to try to get at this pain and suffering piece. And as Tina spoke about, jury awards include not just pain and suffering, but they also include things like medical costs. And so in order to just isolate the intangible cost, we had to subtract medical costs from the jury award information that we were using, and that left us with what we felt was a pretty good estimate of the pain and suffering associated with crimes. So our study actually measured intangible costs for 4 categories, but in terms of using jury data, we really focused on rape, sexual assault, robbery, and aggravated assault. And I'll discuss murder at the end when I show the final estimates. So the thing to note about the jury compensation method is that jury awards are assigned for injuries, not for crimes. But we were able to link these two based on the probability of sustaining certain injuries. So for example, a robbery would have perhaps injuries like gunshot wounds, cuts, scrapes, etc. And we have data from jury verdict research which provides information on jury awards per injury. We also have information from the National Crime Victimization Survey and supplementary studies conducted by Ted Miller and colleagues that tell us what the probability of injury is for these 3 offenses that we're focusing on. So we're essentially able to piece together this information to estimate the value of pain and suffering for rape, sexual assault, aggravated assault, and robbery. So moving on to the third method, willingness to pay. So this is also a way of capturing intangible victim costs. By essentially conducting a survey, you ask the general population, what would you be willing to pay to avoid being a victim of a crime? And Mark Cohen has done work in this area. There's also studies by Ludwig and Cook that looked at willingness to pay to avoid gun violence. So there's an interesting literature out there. The data that you see presented here was based on 2004 study by Mark Cohen, where he surveyed more than 1,000 residents and found that individuals, or on a household basis, are willing to pay between $100 and $150 to reduce serious crimes in their neighborhoods by 10%. So sparing you all of the formulas behind this, what this translates to is a willingness to pay or a cost per rape sexual assault of $286,277, and armed robbery more than $280,000, serious assault more than $84,000, burglary more than $30,000. The interesting thing about willingness to pay is that it is supposed to be more closely aligned with the societal perspective. However, it tends to generate estimates that are higher than some of these other approaches, and in fact, the estimates for rape, sexual assault, and robbery are quite a bit higher than the ones we found in our study. So that can, some people feel a bit skeptical about some of these willingness to pay estimates, and in addition, this is a very costly approach. It's very expensive to conduct surveys, so we don't tend to see as many of these as we do cost of illness studies. Okay, so let me get into some of the numbers that we found in our study. So the example that I'm going to use is a robbery. And so focusing first on the tangible side, using the data that I mentioned earlier, the total economic loss that includes medical costs and lost productivity of all robberies was more than $967 million. So when you divide that by the actual number of robberies, you get a per offense economic loss of $1,357. Add to this the risk of homicide cost using lifetime earnings of $1,663 plus the mental health care costs from the Miller and Cohen study of more than $1,047, and you get a total tangible robbery cost of $3,299. And let me just clarify, this is just the victim piece. We also include in our estimates the costs to the criminal justice system and crime career losses. So for our tangible cost of robbery is higher than this because it includes those two other pieces. But in terms of victim costs specifically, you have almost $3,300 in costs per robbery offense. On the intangible side, the table that you see here shows you some of the jury award data that I was describing very briefly earlier. It doesn't perhaps give you enough of a snapshot on how this works. But anyway, you can see here that there are various injuries that tend to be associated with robbery, things like gunshot wounds, knife wounds, being knocked unconscious. The average jury award for each of these injuries is presented in the second column. And when you subtract out the cost specifically for medical care, you get a pain and suffering estimate of a little bit less. You can see for gunshot wound, the pain and suffering estimate of that injury was a little more than $48,000. For being knocked unconscious, the pain and suffering piece was about $4,200. So we were able to take these pain and suffering estimates, add them all up, and then multiply by the probability that these specific injuries would occur during a robbery. And as I said before, you can piece all of that together to get the intangible cost per robbery. There's a lot more detail in there, but I'll just refer you to the paper, or I'm happy to answer specific questions later, time permitting, on how you do that a little bit more carefully. So let me present now the summary table in the paper, which shows victim costs and total costs for the 13 offenses that we featured. The tangible cost piece, let me just remind you, includes not just the victim costs, but also the costs to the criminal justice system and crime career losses, productivity losses. So you can see that for murder, it was more than $1.2 million in tangible costs for just going down the list. Some of the property crimes, things like household burglary, for example, a little more than $6,000 per offense for the tangible costs. The intangible costs, these include, as I said, the pain and suffering for rape, sexual assault, aggravated assault, and robbery. And it also includes a corrected risk of homicide for some of these other offenses, including murder, arson, motor vehicle theft, and household burglary. And when I say corrected risk of homicide, I'll just mention quickly that instead of using lifetime earnings, which is a very conservative way of valuing life, you can use another estimate, which is called the value of a statistical life, which tends to be much higher than earnings. And we used research conducted by Kip Viscusi, who's a very well-known health economist, who's estimated the value of a statistical life, which is something like more than $6 million. So when you apply the probability that some of these offenses will result in homicide by that corrected value of a statistical life, you get a much higher intangible piece or intangible cost associated with these crimes, particularly for murder, which puts that at over $8.4 million. The final column in this table is really, that's the important column for us. That's what we use for these benefit cost analyses that I mentioned earlier. But basically you've got murder more than almost $9 million per offense. You've got robbery, for example, $42,000 per offense. And of course the property crimes are anywhere between $3,000 and maybe $7,000, $8,000 per offense. And I'll just note if you're trying to add these two, the tangible and the intangible piece up, it's not going to add up to that final column total cost because of the corrected risk of homicide piece that I just described. So in order to add this up to get a total cost estimate per offense, we had to subtract the conservative risk of homicide piece from the tangible cost column that you see there, and then add in the more liberal risk of homicide cost under the intangible column. Anyway, you can see that, that without including the intangible piece, you're really underestimating the societal impact of these different offenses. And the nice thing about the way we present this in the paper is that you can actually look at the role or the criminal justice piece separately. You can look at the crime career piece separately. And so if you wanted to create a more narrow perspective on the impact of crime, you could do that and sort of isolate just whatever agency or stakeholder's perspective you're interested in. Let me briefly go over the challenges and limitations, of which there were many in conducting a study like this. But primarily we had to rely on national data, and of course local costs may be quite different, particularly criminal justice system costs. And we just didn't have access to data that would allow us to get down to that level. We also did not have estimates for crimes like drug law violations or prostitution, which actually are very important crimes when you're doing substance abuse treatment evaluations, but we just don't have a good source of data on the incidence of those crimes or the real costs associated with those crimes. The other thing is we weren't able to isolate the costs of psychological distress or even the specific quality of life piece in the intangible victim costs, so those aren't included. And also the costs of crime prevention efforts, like when people go out and purchase a security system. We weren't able to include those costs in these estimates because there just aren't, there are no data sources available that would allow us to assign that to specific offenses. So I'll just end my talk here and welcome any questions you have.
Thank you, Kathryn, and thank you, Tina, of course. Before we open the Q&A session, I actually wanted to pose a couple of questions to our presenters. My first question is, what are some advantages and disadvantages of each of the methods? Either Tina or Kathryn, you can answer the question.
Well, I'll just jump in since I just finished talking about some of the methods, and I think I highlighted this in a couple of the slides. But in terms of the three approaches, the cost of illness approach is very popular. One of the advantages is there are a lot of national data sources available to try to get at some of the victim cost pieces, but the intangible piece is missing. So it's an advantage in terms of the tangible costs. You can be at a disadvantage in terms of trying to estimate the intangible piece. In terms of jury compensation, the strengths are that you do have access to a large, unique data set, but in order to piece together, the injuries and the costs associated with injuries and translate that into an intangible pain and suffering cost per offense, you're relying on a lot of assumptions. And so, that can be somewhat limiting. We're not always sure that we're accurately assigning the true intangible piece to those costs. And then as I mentioned with willingness to pay, economists say this is great for getting closer to the societal perspective or to capturing the societal impact, but as I mentioned, it's really costly to conduct these surveys, and many individuals are skeptical about the higher or extremely high values that some of these willingness to pay studies come up with.
Thank you, Kathryn. Another question I had was, what kind of concerns have you heard about these kinds of estimates, and how do you address them? One question we sometimes get is whether placing a dollar value on victimization is ethical. Have you heard such questions, and how do you respond to them?
This is Tina speaking. I haven't had an advocate approach me with any specific concerns about this, but having thought it through in preparation for the presentation, I can see how that could come up as a legitimate question. But I'm of the opinion that information is powerful, and accurate information can be used to affect positive changes. So I think the more we work together to use the research that's available to our individual work to inform the collective, I think it's going to be powerful in terms of helping to shape future policy. And I think the value is there. And I think that it's up to us, the people who work in these fields, to, again, to collaborate meaningfully, to share good data, to sharpen the data by virtue of what we're learning about what we have and what we don't have. For example, in terms of looking at cost of illness method or jury comp method, it appears to me that there are things that are missing. If you're looking at reported crimes, for example, as it appears that the cost of illness can count, then you're missing all the unreported. Same thing with jury comp. That's a small subset of all those serious crimes, even the very serious crimes. Many of them play out completely within the criminal justice system and never go to a civil jury. So looking at the whole picture of the data that's available, trying to figure out where we can get these other pieces from, can be helpful in creating more credible research that can guide good policy.
Thank you, Tina. So I think we'll open it up to questions now. And we have one question. Do you think it's important to measure local costs, local victim costs, before doing a cost-benefit analysis?
I'll just say that I think if you can get down, depending on what your research question is, a lot of cost-benefit analysis, if the goal is to inform policy, you want to try to base that on more of a societal or national perspective. But if you're trying to make decisions at the community level, then I think absolutely you would want to try to include local costs. And just going back to what Tina just said, I mean, trying to access better sources of data at the local or even state level would help to refine the estimates that I presented for those purposes.
And another question, this is a question from Arlene, probably also for Kathryn. What about crimes with no jury awards or cases with no jury awards? How would you estimate victim costs for those?
Yeah, well, we're at a disadvantage there. We were really stuck with, not really stuck because it's actually a really great approach and something that hasn't been done enough. But anything that there isn't data on particular injuries associated with a lot of those lesser offenses in particular, we just don't have a way of getting at a pain and suffering piece for that. One way you could do it is by conducting a willingness to pay survey, but as I mentioned, there are advantages and disadvantages to that.
Mm-hmm. We have a couple of questions about using lifetime earnings to estimate the value of life. So for example, what if a person doesn't work, if they're a homemaker or a stay-at-home mom? How does that factor into estimating value of life using lifetime earnings?
Actually, there's a couple of ways you can look at that. And a lot of these estimations are subject to sensitivity analyses. So we actually ran some different sensitivity analyses as we were putting these together using higher and lower bound estimates for areas like this that maybe didn't have data. But in terms of those that are not in the workforce, you can do a couple of things. You can use the minimum wage as sort of a lower bound estimate on if they were engaging in some activity, at least a minimum amount that they might be earning, and impute that. Another thing you can do is use like homemaker earnings or household cleaning, something like that could serve as a proxy for what someone who's not in a workforce might be doing at home. So there's a couple of different ways of getting at imputing a value for that.
Mm-hmm. We have another question about long-term victimization. Tina talked about how many victims of crime incur long-term costs as a result of their experience. How do you account for that? Those long-term pain and suffering costs, or maybe even long-term direct out-of-pocket expenses?
In terms of,
oh, go ahead. Go ahead, Tina. I'm sorry. I wasn't sure if that was directed at me or you.
I think there certainly is a piece of it that you can address and probably should address. But in terms of looking at what state agencies are doing with those long-term costs, many states have a maximum for certain types of expenses. New York is the exception in that it doesn't. So for a case involving extreme trauma with involved years of counseling, you can sort of measure it over time with those extreme cases and maybe even relate them to a particular crime type. So that is a way in terms of looking at what the different state agencies are doing to look at long-term costs, because when I think of long-term costs, I think of counseling as being either the first or the second, and continuing medical care as being the first or the second. They're the top two for sure. And when you talk about continuing medical care, you're talking about devastating injuries as a result of a crime, someone who is paralyzed by virtue of a gunshot, or completely debilitated, or their life forever changed by virtue of a traumatic brain injury from a vehicular assault, something of that nature, or even a physical assault. So those types of categories of crime type tend to be these long-term cases that I think are being asked about.
We have a question from Fred. I think this is a question for Kathryn. Have there been any cost estimates for lower-level offenses like jumping turnstiles, simple assault, prostitution, crimes like that?
There are a few out there. Nothing recent, at least as far as I know. Maybe there, something could have come out. But the problem is with something like prostitution, and I think Tina mentioned this as well. We just don't know the true number of offenses, and so it's really difficult to get an accurate cost per offense. And some studies have done it and estimated something really low, like $20 or something per offense. But those are the more challenging crimes to get at. Even simple assault, which is actually a very common crime, and we had trouble using the current data sources that we used for this study and trying to break up aggravated assault and simple assault. And so that would be something that I think future studies could take a look at, trying to get at some of those lesser crimes. Maybe there's local or state sources that would have better information.
We have a question from Joseph. I think this is also for Kathryn. Did your study account for repeat victimization at all?
No, it didn't. It was, we used a lot of information from the National Crime Victimization Survey. So in terms of incidents, it was just whatever, the total number of victimizations that were reported there. We didn't have a chance to get at what I would imagine would have perhaps a compounding effect on the costs of repeat victimization. Just we didn't have the data to do that.
Mm-hmm. Also another question, has there been any studies, the question from Danette, have there been any victim cost studies focusing specifically on domestic violence? And how would you go about estimating that? Kathryn, you can go ahead.
Okay. I think I have seen some. I know I have seen some sexual assault estimations, and actually Ted Miller, who I mentioned, did a study in Minnesota, I believe, that looked at that. But I haven't seen anything that I would even be able to cite who the authors are for domestic violence. But I wouldn't be surprised if some of that was out there. And again, I'm not familiar with a lot of the data sources in that area, so I'm not sure how you would approach getting at that. But I would suspect a quick lit search you might find some things that would be of interest to you.
Mm-hmm. We have a question from, I think, Aviva. The majority of rapes and sex assaults are typically not accompanied by physical injury. How does that impact the formula?
Well, it's not factored in at all, unfortunately. I mean, in our case, we used offenses that were reported. So anything that I mean, so there would naturally be a pain and suffering element associated there, but if there weren't, if it wasn't reported and there weren't any specific injuries to try to match a jury award to, we wouldn't be able to get at that. It's unfortunate that we don't have more refined data sources out there.
We have one last question. Has anyone tried to measure the benefit of services offered after victimization? Either for Kathryn or Tina.
The benefit in terms of improved mental health outcomes or something like that?
Yeah, I think so.
I haven't seen anything looking at that. I don't know, Tina, has your office dealt with anything like that?
In the last year or so, I've been trying to look at performance measures and ways to evaluate successful programs that our office or other state agencies' offices might fund. And there have been some tools put together to help agencies like mine evaluate the performance of the programs that it funds that work directly with victims. We haven't been able to undertake an evaluation statewide in New York, but I do believe that the tools exist and that some states have been able to do studies, either small or larger studies, on the effectiveness of the programs that they fund, looking at surveys of the victims in terms of their satisfaction, in terms of their well-being after working with the victim assistance providers. So I think there has been some work done. If it's big studies, I'm not sure about that, but I think on the state level, some studies in different states have been done.
And just to add to that, I think one way to measure the benefit of such services might be also to use some of these studies that place a dollar value, say, on mental health costs. So if you know that the particular victim services programs reduces mental health costs, and you know the mental health costs associated with different kinds of victimization, you can use those avoided mental health costs to estimate the benefits of the services. That would be one approach. So we're going to wrap up really quickly. On your screen, and we wanted to share a couple of the studies that have been mentioned during the webinar. The first study, the cost of crime to society, new crime-specific estimates for policy and program evaluation. This is a study that Kathryn has been talking about. We also sent you a copy of the study in the reminder, so you should have the full text available. The second study by Ted Miller is a study that Kathryn mentioned about measuring the mental health costs of victimization. And the third study also discusses some of the methodologies that Kathryn discusses today. Sort of Mark Cohen developed those methodologies in the 90s. And this PowerPoint will be available after the webinar, so you can come back to this slide and take a look at these studies again. When you exit out of this webinar, please complete the evaluation. You can also share any comments and questions you have with us on Twitter and Facebook. Our username on Twitter is CBKBank, and our hashtag is CBKBWebinar. And you can find us on Facebook. Our username is CostBenefit. You can also visit the Cost Benefit Knowledge Bank for Criminal Justice website at cbkb.org and subscribe to receive updates from CBKB. The Cost Benefit Knowledge Bank is a project of the Vera Institute of Justice and is funded by the U.S. Department of Justice's Bureau of Justice Assistance. And in addition to webinars such as this, the Knowledge Bank features a broad range of resources on cost benefit and criminal justice, including a cost benefit toolkit, the website, snapshots on cost benefit literature, podcasts, and other resources. You're also welcome to contact myself and as well as Tina and Kathryn using emails on the screen, and we'll be happy to answer any additional questions. Thank you very much, and stay tuned for upcoming webinars. Thank you.
Thank you.